Hi, I'm Britt Girvan, host of What the Morgs podcast, and I am so happy that you're here. This podcast is dedicated to raising awareness for both Lyme and Morgellons disease. I promise to give you authentic conversation, lived experiences, and expert interviews with people in the medical community. I'm so grateful that you're here. Thank you so much for tuning in. Welcome to part 2 of my interview with Dr. Ginger Savely.
Validation is so important. That's a very easy gift to give to somebody. Why can't more doctors do it? I always tell my patients, especially my young ones, I say, if you can get through this, you can get through anything.
Thank you for seeing us, for believing in us.
I don't think Lyme causes Morgellons. No way. There's one researcher that made that statement once, and then all people took it and ran with it. I don't think Morgellons has anything to do with Lyme other than the fact that.
Welcome to part 2 of my interview with Dr. Ginger Savely. Dr. Ginger Savely is a world-renowned specialist in tick-borne diseases. You can find episode 1, A Conversation with Dr. Ginger Savely, leading expert on Morgellons and Lyme disease, on Spotify, Apple, or on all of your favorite podcast platforms. So I think sometimes I have a few people in my community that maybe have newer diagnosis. And, I know this for myself, that when I first started this journey, I didn't understand truly what peeling the layers of the onion back meant.
Yeah, right.
Because I remember initially starting the whole process and just can't we, get going, but I get it. I get it now. It is a very long, arduous, difficult journey. The minute you start, you get far worse than you ever felt. I don't know that, because, and what made me think of it is when you were saying, they started off on the antibiotics and it was like, I'm going to go do this.
Yeah.
And so so it's interesting. I'm kind of running into that a little bit. I mean, one, they don't necessarily want to hear Morgellons. They don't. They do not.
Yeah.
I
Yeah.
get it. But also, I just, it is a very long process, and it is like peeling the layers of an onion back in order to get, your immune system functioning again. And there's just so much dependent upon how long you've been ill. So I was, obviously misdiagnosed for I'm going to say probably I'd had it for 15 years. So it had a lot of time to do quite a bit of damage.
Right.
Um, but, and I don't want that for them. So, it's kind of like, I wish that they would just sort of buy in a little bit earlier,
Yes,
because
I
to
know.
your point, a year from now, they're going to come back. They're going to be in a similar situation. Um, but I don't know how else to sort of describe the journey.
Yeah, but you know what, Britt, they have to come to it when they're ready. And if it takes going off and doing voodoo for a year, whatever, then that's okay. Because
Yeah.
when they come to it, they need to be ready. You can't force it. I'm always seeing parents trying to force their teenager or something into it. No, I always say, I'm not going to treat anybody until they come to me. I need help. I'm not going to push it on your husband. I'm not going to push it on your teenager, anything like that, because it always is a disaster. It's just not. So I want them to be ready and them to be the ones that say, okay, do your thing. I need it now. I need help. And it just works better that way when people are ready. And it just takes some people longer to be ready, or even to come out of their denial that they really have something that needs to be
Yeah.
dealt with,
Yeah.
so it's tough. There was a lot of psychology involved in all of this too, because of the way people are already come to me or anyone else who's treating them for this kind of with a chip on their shoulder, like, ready to hate you because they've had 30 doctors they ended up hating. So they're very mistrustful of the whole medical community, which I don't blame them for at all.
Yes.
So it always has to take a while to kind of win them over, so to speak. That this is a safe place now. That this, I totally believe you. I know what's going on and all that. And they're always kind of shocked because they can't believe that they're allowed to say these things to me, you know. And I'm just so nonchalant when they do. I just say, "Oh yeah, okay, you got pink stuff coming out. Okay, the blue, yep, uh-huh." And because I've just seen it so much. I mean, I haven't had it. Nobody can empathize as well as somebody else who's had it, but I I've been around it a lot now for 25 years, and so I'm kind of familiar with every different presentation which it could have.
Yeah,
So,
it's a big deal. Building trust, after typically what we've been through is a big deal. I remember finding my naturopath who also actually she has Lyme and Morgellons as well,
okay.
and just I bawled. I'd never
Yes.
met anybody else, and then just to be valued and seen and heard was the gift that just I
Exactly.
it was just, and then my derm actually is one of the few here in, Portland that, is a champion for Morgellons, and I feel so grateful, and to your point, he is one of very few, and he and I have discussed, you know, um, maybe doing some things here in Portland around education and things like that, and he has just run into all the similar brick walls that you have, with colleagues, and,
Portland is tough.
it's
They're not very kind to their doctors there that do, alternate things. I've,
no,
had a number of colleagues there.
yeah.
So, yeah, I know they're tough.
Yeah, and he runs the residency training program, and that is where he effectively is making change. So he is
Good.
starting those residents fresh. And I actually interviewed him yesterday, and he had said that one of his residents, because of her experience with Dr. Keller in Portland in clinic, she had her first Morgellons patient in Washington State that she treated.
Oh, good, good,
And
good.
that, just I mean, that's a gift. I mean, that's a
Right. I
gift.
mean, validation is so important. I always feel like, gee, that's a very easy gift to give to somebody. Why can't more doctors do it? I just don't get it. But, I often have people come to me for the first time and they walk out the door saying, I feel 50% better. Just, but mainly just because
It's
somebody
true.
heard them, and
It's
listened.
so
And
true. I
yeah.
remember I felt the exact same way.
Hmm.
The exact same way. I
Right.
just cried and cried and I needed to. I mean, honestly, I think it's part of the healing as well.
Sure.
Um,
Of
I think it's
course.
pretty
Of
critical.
course.
Yeah, it's really
In my
critical.
office, I always have a big box of tissues because I expect that. It's kind of the overwhelming release. Like yesterday, I told somebody who'd been sick so long, this always happens though. I told her, yeah, well, you do have Lyme and Bartonella. And she got tears in her eyes and she said, "I am so excited to hear that," because, and that's the way it is. It's like
I
usually
get
people
it.
aren't excited to get a diagnosis, but when you've been searching for 15 years, then you are. And
Yeah.
and you feel like, "See, I told you something was wrong with me." So it's very actually it's very difficult what I do, but it's so rewarding. It's just so rewarding.
Thank
And
you.
yeah, I mean, gosh, just to you feel like you're really having a huge impact. A lot different than family practice, that I used to do, where people would come in with their bladder infections and their sprained ankles and their colds, and it was pretty basic, easy stuff. I remember one time recently, I filled in for a colleague of mine who went on a vacation. He's family practice, so I went and worked in family practice again for a week after doing all of this. And people would come in and they'll say, my ankles hurt. And I just like, that's all? And I felt like, "That's all you've got?"
Uh-huh, uh-huh,
Yes. I'm used to people with 35 symptoms, and so
uh-huh.
it seemed like falling off a log going back to family practice.
Oh,
Yeah,
yeah, that's yeah, I mean, oh, I mean, to have something as simple as that would be a gift. I mean,
exactly.
honestly, but they, they don't know any different. I
Right.
would have never known had I not had this experience, and I've had a really colorful life, but this is beyond colorful,
I
literally, literally.
yeah, literally. I always tell my patients, especially my young ones, I say, "If you can get through this, you can get through anything." And, only the strong survive, and, you're a tough person, so you're gonna get through this.
Mhm.
And it's gonna change you in a ways that are actually really good ways, because it's gonna make you very empathetic to a lot of people you might not have been before, and it also is going to make you appreciate your health when you have it, because the average person takes that for granted. They just,
Yeah.
go along, or people as lucky as my husband, who's just healthy as a horse all the time, he doesn't even think about it. And whereas I've never had Morgellons, but I was very, very sick with Lyme 30 years ago, in bed for a year and all that. There's not a day that goes by when I'm not consciously kind of aware and excited about the fact that, wait, I feel good today. I really notice it. And once you've been through this, I think you do. You have more appreciation.
Now I have even more questions. I'm like, your own treatment and have you had flare-ups? When you have flare-ups, how do you treat?
I
Um,
don't a lot of my long-term patients, like me and my daughter, and actually my other daughter ended up getting it too.
okay.
So this is what we do in our family. We all kind of, our little language amongst ourselves is I'm having a limey day, we'll say, and then we immediately know what each other means, because it just means every now and then we still just have a day. Usually it's after not enough sleep, eating some junk food, whatever. There's an explanation
Yeah.
where you just feel that lightheaded and achy, and just that whole, it just comes back to you. But as the years go on, it goes away pretty quickly. And we just rest, act like we're having some kind of a virus or something, and then and then it's gone. And so over the years, I've had those episodes less and less and less and less, and they become less severe. So I remember the first couple of years after I was done with treatment, I sometimes would get those, and I'd be pretty sick for a week or two, but then they'd be gone. So as time goes on, and I've seen this with my patients too, that they gradually have less and less flares, and they're less severe, to the point where it gets rare. And it's very rare for me now. And I think it mostly only happens to me when I'm having really bad seasonal allergies. And that sort of,
That makes
kicks
sense.
things up. So I don't know. It's probably just I'm getting inflamed, because really, like I always tell my patients, what I should, the sign I should have on the door is, we treat inflammation, because basically that's what I'm treating.
Yeah,
It's caused by different things in different people, but inflammation is what's causing the symptoms. And
right.
so once you get inflamed and you know those symptoms so well, anytime you get inflamed in the future, and it could be just because you ate 2 bags of candy one night or something, you're going to have those same symptoms again, those same symptoms that you know so well. For some people, it's hot flushes, and some people it's dizziness and achiness, and they're just different ways it comes out in people. But people get very used to that feeling, the feeling feverish when you don't have fever, for example, that kind of thing. That's a real
Okay.
common one. Yeah,
Mhm.
so we're fine now. My daughter, who was the sickest, is now 42. She just had her first baby, something she never was sure she was going to be able to do. She gradually got
Congratulations.
better. Pardon?
Congratulations.
No, thank you. And she gradually got better through the years, but still, it's rough for her, and she has a hard time keeping down a job just because the unpredictability. You know, so she'll be fine, 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 and then it hits her, and it's the unpredictability that makes it difficult for her to hold down just a regular kind of 8 to 5 job. So she's always sort of had to do, work
Yeah.
from the home, doing her own thing,
Yeah.
but it's, then my other daughter has really got a very, very go-go job. She really has works hard, but she wasn't quite as sick. But and also she's just really tough and she just goes through it.
So, did it affect your daughter's cognition then? Because I know you mentioned
Absolutely.
wheelchair. Okay, because
Terribly.
that's me, is my cognition.
And, what I've talked to so many parents who went through their kids being sick, both my patients and also just people I run into at conferences, and the primary thing that seems to stick around with these kids that get sick is the executive functioning. And that even once they start to feel better overall and they
Really?
they actually can kind of think pretty clearly and all that, but the executive functioning, that, they have such a difficulty with that, which makes it very hard for them to, say, get through college, if they're going to college, just the whole thing of getting their thoughts organized and getting, to write a paper for something is just like, overwhelming for them, and that's a thing that takes quite a long time to
Yes,
come back.
definitely. Is there any specific treatment protocol that you might have specifically for the cognitive piece of it, for example? And again, I know it's different in everybody, but I'm curious.
Well, what I learned from Dr. Charles Ray Jones, who I did intern under, and he was, for those who don't know, he passed away a few years ago, but he was basically the pediatric Lyme guru of the world. He treated about 20,000 children with Lyme from all over the world, so he really
Wow. Yep.
knew his stuff there with that. And so he taught me a lot of important things that you just learn clinically, not that there's the research studies behind it, but that you learn clinically. Uh, I am going to have to now admit that I forgot where we started. What was the question?
I asked about, is there any treatment protocol that you do specifically for
Ah,
cognition?
yes. Good. Thank you so much for remembering that. Woohoo. Okay. Yes. Dr. Jones is the one who taught me that the very best thing for the brain is the, metronidazole. Flagyl is the name brand of that. And that he found is extremely important part of the treatment for people who had a lot of cognitive. Then, of course, for certain patients, it's intravenous too. But he always found that, like, if, for example, he treated a lot of kids that were diagnosed with autism or pandas, different things like that. And he found that the metronidazole was a really important part in terms of getting to the brain and fixing that.
And not
So,
and limited side effects for that one?
well, it's tough. It's very tough because it causes the toughest herxes of all, because it goes in there and wakes up the dormant bacteria. And also, people do have stomach troubles with it sometime. I'll try if they can't tolerate metronidazole, then I'll switch them over to tinidazole, a close cousin. But sometimes people can tolerate one and not the other. They're very similar, and they're both great cyst busters for Lyme. And so that's always included in the treatment. However, there has to be a certain amount of pulse to it because those are medications that can create neuropathies if taken consistently over a long period of time. So I always do them in a pulsed manner, like 3 weeks on, 1 week off, if they can tolerate that. So, but usually working up very gradually to that because it, pardon the expression, kicks your butt really bad. And so we have to start really low on that and work into it. Yeah.
Yeah, I did tinidazole and somewhere in my
Mhm.
protocol. It's been a minute. And I don't generally herx like most folks, but
Lucky
my
you.
herxing is more emotional.
Mm. It
So
always is with metronidazole and tinidazole. I
it's
always say
interesting.
metronidazole, the herxing is from the neck up. In other words, headaches, depression,
Mhm.
and cognitive stuff
Yep.
problems. That's the kirksing I see a lot with those 2, the metronidazole and tinidazole. But, well, I always tell my patients, the very ways that it makes you feel awful when you first start on it, those are the very things it's going to make better. So they get kind of used to that. They know that if this medication is making my muscle twitches way worse, that's the medication they need for their muscle twitches, and that's going to eventually take care of
Right.
it.
Right.
Yeah, it's
I'm curious, has there been, have you noticed any changes in the last 25 years since you've been treating? Like, have they shifted at all? I mean, is there anything different? Um,
well, here's the things I've noticed. Number one, there is a slight improvement in the sense that now, or in the early days of me treating this, I would get calls from doctors yelling at me for what I was doing, and saying that, it was ridiculous, I was harming people, that they didn't have anything anyway, I shouldn't be, all that. And now what is happening now is literally I'm getting emails every day from doctors around the world asking
awesome.
for help in treating.
Awesome.
Like they say, I know this patient has Morgellons disease, but I don't know what to do. And I've written a white paper for those people, and
That's a start.
I send them a lot of information. I've had people come up to me at conferences and they say, "Thank you for saving my life." And I'll be like, I don't think I know you. And they say, "Oh, no, you don't know me, but you helped my doctor treat me." And I'll
That's
be, "Oh, that's so great to hear,"
that's
That's
awesome. I mean, that's a huge shift too.
Mhm. It's
That
huge shift. Oh my
that
gosh, so huge. So
and so
that's
you're
what
seeing globally, people are
Yep.
reaching out globally?
Absolutely, absolutely, all
That's
over the
awesome.
world. Sometimes I'm so shocked to see where these things come from, these doctors come from, and then also, of course, I always wonder, how do they know about me? But anyway, I'm all ready for them. I've got this whole packet of things I send out to other healthcare providers with prescriptive authority. I can only send it to them, not to patients, just for medical legal reasons. So, but it's something that if a patient asks their doctor to ask me for, I'm happy to send it to them. And that has helped a lot of doctors who've asked me because their hearts are in the right place. They know this is something they want to help, but they just don't know where to begin.
Yeah,
So,
yeah.
you gotta
Well,
respect that. I mean, that's
that's a
so much
shift.
better than
That's a positive change.
absolutely.
That makes me really
Very
happy.
much so. I'm very
Wow.
happy to see that. I don't get people yelling at me anymore. Yay.
Yay. Yay.
I'm a sensitive soul, so it's hard for me. Yeah, it was tough there in the early years of it for sure, but I mean,
I
it's
can imagine. And then, I'm curious. So right behind you is the cover of your book,
yes,
Morgellons,
it is.
the legitimization of a disease. So is there any talk of a new edition? Have you found any new findings? Where are you at in that process?
I'll tell you what, when that came out, I intended to do a every year
Yeah.
to update it, and there has not been anything new. It's been 9.5 years since I
Wow.
did that book. I totally plan to update it, all the time. There isn't anything. There's nothing new to say that's
Interesting.
not already in there.
Interesting.
Um, so, it's just sad to say, but things there was a lot of interest in Morgellons disease about maybe 15 years ago. Like I was on TV things all the time. So was Cindy Casey of the Morgellons Foundation. People, it's sort of, I think news people kind of got excited, like, oh, this is cool, something different, So there was a flurry of different little shows featuring it, like Diane Rehm show, and then we were on several those shows like Monsters Inside Me, or I can't even remember those kind of shows, and interviewed a lot of times. But then that sort of died down. And like I said, that was more like somewhere between 10 and 15 years ago. And people just don't seem to be as interested in it anymore. I'm not sure why.
That's curious.
We need to rev up interest again in it.
I'm hoping that this podcast will, at least create another opportunity to be heard, to be seen, and to be valued, most importantly. Um, yeah, I mean it's a difficult situation. There isn't enough funding, so
I know.
we can only, with the limited resources that we do have, right, just even in our own community and then outside of the community, it's so limited as it relates to clinicians. It's
I
terrible.
know.
It's
I
terrible.
I'm frustrated by it all the time, and I'm kind of, I should be retired now. I'm 75 years old. I'm, kind of, I mean, I'm getting a little bit tired, I have to say, but I mean, I'm very passionate about what I do, so I'm still at it. I've cut back. I don't, do it really full time anymore. But I don't have the energy anymore for going and sort of fighting City Hall, I need some of the younger people to try to do that, and become political and make a big fuss about it. Years ago, we had a big protest right in Atlanta, right around the CDC about it. So I'm hoping some new fresh blood will come along that has that. But the problem is they usually are sick themselves, so nobody has the
Yep.
energy to do it. That's what we've always found with these foundations and everything, is that we'll give assignments for people to do, and then we have another board meeting the next month, and oh, I didn't do it. I felt too bad this month, that kind of thing. So,
I get
it's
that. I get that. I mean, it
yeah,
took me a long time to get to this place,
right.
to feel well enough. Um, and what I mean by that, more importantly, is my cognition, my follow through, my ability to retain information. Initially um I mean, it's still a challenge for me to read, so I do better with any sort of,
Yeah.
audio. I can read it, it's just I can't retain it. But I know I'm improving, otherwise I wouldn't be here.
Right, right. It's a slow thing, and it's the last thing to come back. That's what I always tell my patients. It's the last thing, and we always joke and say, of all the things I've lost, I miss my mind the most. And you got to have a little humor with all this. You can't survive without it.
Yeah,
But
that's funny. I always say, I can't wait to meet myself again,
right.
you know?
Yeah,
I
yeah,
just
exactly.
still waiting, still waiting.
Yes. I used to use expressions like, when I felt like I was coming out of things and my brain was coming back, like I would say, I feel like a real person again.
Mhm.
Because I
I
felt
get it.
like just only a partial
Part.
human
Yeah.
when I was so sick. Yeah.
Yeah, definitely like a shell. It's hard to describe. It's
Hmm.
really hard to
Oh.
describe. People don't understand how sick we are.
No, they don't, and they often just kind of look at you and go, "Well, you look fine to me."
Mhm.
And they do the basic labs, and they're usually fine on my
Mhm.
patients, things like their CBC and their metabolic panel. And so they're, "Well, you're fine." Yeah.
I'm curious, and I know we need to wrap it up, but I have so many questions. I could sit and talk to you for forever. But eh, you know, um when I first was given the Morgellons diagnosis, there was a couple people that described it in the community as Lyme on steroids. So
It's
meaning,
really
okay,
incorrect. Yeah.
okay,
First of all, I don't think Morgellons has anything to do with Lyme other than the fact that a lot of the patients have Lyme because that's a big immunosuppressant. I don't think Lyme causes Morgellons. No way. There's, one researcher that made that statement once, and then all people took it and ran with it, and it's not correct. We've not shown that to be the case at all. I mean, who knows what's correct, but we definitely do not know what causes this. No way. I mean, we've looked in the lesions to see what bacteria are in the lesions, and there's a lot of bacteria in the lesions. But anyway, that doesn't mean they caused it. I
Right.
mean, there's a lot of bacteria. You can get a lesion for any reason, and there's going to be a lot of bacteria in it, but it doesn't mean that caused it. That's another big step in research to go to saying what's a causative pathogen. And all they've done so far is just say, here's what we find in the lesions. Well, I'm not sure what that really means,
Right.
and they found different things. They found Lyme spirochetes, they found Bartonella, they found weird things like Treponema denticola, which is supposed to only be in the mouth. They found that in these. So who knows what that all means, but it's a very early step in research, and we're not even close to a point of saying this is Lyme on steroids. No, no way. But it is a lot worse than having just Lyme for sure. I mean, I honestly have gotten to a point, it sounds funny to say, but when I look at my patient list before I start in the morning, and then I'll look and I'll go see that one of them is just Lyme, and then we're done. And I'm so excited. It's like, oh boy, yay!
Uh-huh.
It's like a walk in the park, because after you've treated Morgellons, then you think, oh wow, the Lyme is, it's not so bad. It's
Mhm.
it's bad, but it's not as bad as what the Morgellons patients are going through. So I guess in that way, you could call it Lyme on steroids, just in the sense that, I mean, you could call it a cold on steroids too. I mean, it's just you feel so much sicker.
Yeah. Yeah,
But
for
yeah.
sure. So for those listeners who might have a clinician who might be open to to reaching out to collaborate and educate themselves, are you do you offer that
Yep.
to folks, and
Yes, all
how
the
could
time.
they get in contact with you?
Yes, the doctor themselves, not the patient, has to send an email to Lyme DC,
Okay.
LYME, and then DC is for District of Columbia, lymedc@gmail.com. And just ask for they can say my white paper on Morgellons, or they can just say my treatment help for or whatever. And then I sort of have a whole packet of things that I send to them,
Okay.
uh, talking about different aspects of it, just symptom management and herbal treatments, antibiotic protocols, the whole bit. And a lot of people have been treated by their doctors based on that and gotten better. So I just can't anymore. Sometimes they want me to call them and talk with them, and I can't. There's just not time to do that.
I
There's
understand.
there's too many, and so that's why I spent the time to really put together this good packet that kind of probably has everything in it that they would ever ask.
I would love a copy of that packet if that is possible.
Well, like I said, for medical
Only for
legal
clinicians.
reasons, I can only provide it to people who have prescriptive authority.
Got it.
Nurse practitioner, a PA, a physician, whatever like that. Now, that is all because part of the investigation against me had to do with, and it wasn't true actually, but I was accused of treating somebody without ever even seeing them. And all I did was give some sort of general advice about treatment to somebody, but then that person decided they would report me to the medical board, and you just never know. So I've gotten to the point where I maybe
Oh, I
am being
understand.
paranoid, but I've just been through so much
Oh, I
Craziness.
don't want anything to happen to you. So no,
That I just really try to follow the rules to
you're
the
too
T, so I
valuable.
don't they because see, the problem with all of us who treat Lyme and Morgellons is that, they wanna bring us down, but they often don't really have a good way to, so what they usually do is find other things. Like, even when I was investigated, they weren't really investigating me for treating Lyme. Oh, no, that's what started it, but then they went in and they just tore apart my medical records and crazy stuff like, "Oh, you initialed that instead of signed it," or they just found stuff, all this stuff. And, when I first saw it to the attorney that I used, who did medical practice cases, she looked at it, all the allegations, and she looked at it, and then she looked at me and said, "Who did you piss off?" Because
Wow.
it was obviously such ridiculous stuff.
Yeah.
But that's the way they usually bring the Lyme doctors down, is just because any healthcare provider, if you go in and just examine the heck out of the records, there's going to be things. I mean, everybody's busy, and sometimes you don't have or have it down just exactly the way, but those things are usually not even looked at.
Yeah.
It's just if they want to bring you down for some other reason, that's when they go in and comb the records with a fine-tooth comb and
Yeah.
and and find these things.
Yeah, I don't want anything to happen to you. You're far too valuable. So never
Thanks.
mind.
Thank you. But
No.
ask your doctor too.
Oh no, I definitely will. But for those listening, you can reach out and connect with Dr. Savely via the limedc@gmail.com.
Correct.
If you need assistance, if your clinician needs to collaborate.
And I
Uh,
am still accepting some new patients, so if
okay.
anybody wanted to become a patient, what they need to do is send an email to that address and just ask for a new patient packet.
Okay.
There are occasions when I look over the thing and I think, maybe, this isn't a case I want to take on at this point in my career, because I'll look at it and realize, they need intravenous, so there are some people where I'll tell them, "I think you should find somebody else," but, I'm I'm still taking new patients, so,
Okay. Okay.
if they want to do that.
That's awesome.
Yeah,
That's awesome.
yeah.
Thank you so much
Yeah,
for joining me today. I can't thank you enough, and thank you for seeing us, for believing in us.
of
It
course.
just we need more of you. So I'm hopeful that
There
this
will be.
this opportunity, this podcast series and others like it will hopefully elevate um people to think more clearly and and get involved and learn how to support us better. That would be really helpful.
And I do speak at a lot of medical conferences, and that's where I make the most impact, because some of these doctors, once I show them the photographs on the slides, the presentation, they're just like, "What?" They
That's
they they
that's
just
good.
yeah,
That's good. That's
yeah,
good. Yeah, that's positive. I mean, it's unfortunate, but it's positive. So,
yeah.
yeah. Well,
Thank you,
again,
Brett.
thank you
I
so
appreciate
much.
it and, enjoyed it. Thank you so much.
Thank you so much for tuning in to What the Morgs podcast. I'm beyond grateful that you're here, and thank you so much for being a part of this special community. To learn more, you can visit us at whatthemorgs.com, and you can follow us on Facebook and Instagram at What the Morgs Podcast. Thank you so much for tuning in.